Hi, I've given you so far with my previous post information on what happens to the baby who has reflux and why the baby is suffering, why the baby has all of those symptoms. I've also given you the information about how mother's milk, breast milk, is much better for a baby who has reflux because it becomes less acid than regular formula, than artificial formula. I've also given you the information about the positioning of a baby. A baby who is in a vertical position is better off in an upright position than a baby that has reflux being put down on a horizontal lying down position or even sitting. Actually, this position is very important. The baby who is kept up, vertical, in an upright position is much better off and has less need for treatment of other kind, like drug treatment, pharmacological treatment. Still, the baby who is breastfed at one point or another will suffer just as much as the baby who is bottle fed. After a much longer time, but it reaches the baby, the reflux, also the baby who is breastfed. So we do all of these things. We try and keep the baby on breastfeeding as long as possible. We try and keep the baby in an upright position all day, and maybe sometime or another, even all night if possible. Not on yourself though. It wouldn't be comfortable. We'll see. But all of these things are half of the solution of the problem. The other half of the solution is, unfortunately, for people who don't like to give medications to their babies, and I understand them, but unfortunately to keep the babies comfortable, to make them really, to give them really relief, the medications are the only way to reach your purpose. Before medications though, I'll give you some advice on how to thicken the formula so that it stays down. You can either use a formula which is already in the AR formula, anti-reflux formula, or this is another third of the solution, or within this third of the solution you can make your own thickened formula with rice cereal. You can put a scoop of rice cereal for every scoop of your powdered milk, if you're using powdered milk. If you're using a liquid formula, 1 scoop of rice cereal for every 30 ml of the formula. Then you mix it, you blend it, it becomes very homogeneous and it looks like a yogurt. You could give it with a bottle that has a nipple with a big hole. You can open the hole with a pair of scissors so that the baby can suck this mixture directly from the bottle. This is, as I said, another third of the solution. The other third, or even more of the solution, is 2 medications. There are various medications that are used. One of that I don't use is the so-called alginates. Gaviscon is one of them, and you know why? Because I see that don't work. They don't work on babies, or they don't work enough. So they don't give enough of the relief that we want for the baby who is really suffering, not sleeping, etc., etc. So on this slide, I will be showing you the medications I usually prescribe to my little babies, my babies with reflux. And there is one which you can see on top. It is the lansoprazole, which can be also omeprazole or pantoprazole, one that ends with zole, because they are very good at decreasing the secretion of acid from the stomach. So there is less acid that goes up. Then in my experience, this is not enough. There is another thing that one has to use in order to reach the best result, which is an antacid based on aluminium and magnesium hydroxide. This combination of these two work wonders. The babies that take these medications and all of the other things that I said, after 2 or 3 days from the beginning of treatment, they are much better. The patients that I prescribe this medication always call me back in a few days and say, "Doctor, you changed my life. I changed their life to the better. This makes me happy. I really like to change the life of my patients to the better. It's quite a big pleasure." Goodbye. See you some other time.